His safer at home order took effect April 3rd. Now the governor said he's ready to pull back some of those restrictions. The plan has 3 phases, and the first one begins Monday for most of the state. Jeff Deal is here to explain the changes that some are worried about and others have been waiting for.
Well, one of the biggest things that people will be interested in is restaurants will be allowed to open under certain conditions, but the governor made it clear he believes the biggest change will be medical, that there will be elective surgeries now allowed. When the state essentially shut down over coronavirus concerns, making sure hospitals had space and enough personal protective gear was a big concern. And that meant cutting off elective surgeries.
The reason he did that was concerned that hospitals might run out of PPE, not knowing what the extent of the pandemic was going to be.
But Dr. Jeffrey Stalknaker, chief physician executive for Health First, says we're at a point now his hospital system and others have the equipment they need. And in fact, today, Governor Ron DeSantis spent more than 30 minutes touting Florida hasn't been hit as hard as other states, and the hospital systems have held up well.
Facts should be comforting. We've done much better than everybody said we would do.
He said all that leading into phase 1 of his plan for reopening Florida that everyone has been waiting for.
This was something where we really wanted to get it right. I would have liked to have announced what we were doing 2 weeks ago if I could, but I wanted the data, I wanted the facts.
Some things we already knew. Schools will remain with distance learning. Phase 1 also still prevents visits to senior living facilities. Movie theaters, bars, gyms, and personal grooming businesses like hair salons will remain closed.
Oh, I need it worse than anything. I haven't had a haircut since February.
Those are places he said they considered reopening, but he wanted to make sure it could be done in a safe way. What will be opening back up for business are restaurants. Outdoor seating will be allowed with tables 6 feet apart. Indoors, restaurants will be allowed 25% capacity. Non-essential retail stores will also be allowed to be open at 25% capacity. But he said the biggest change is allowing elective surgeries.
Elective in most cases just means it's elective exactly when you schedule it, but it's usually something you need to get done.
And Dr. Stalknaker said they've had 10 teams preparing the hospitals. Patients will see masks, sanitizing, and even testing of people entering.
We want to reopen again. We want to all get back to work. At the same time, we want to keep folks safe.
If your job was considered essential before, it's still considered essential. That has not changed. The governor said they will continue to reevaluate things, and he'd like to see each phase rolled out in a matter of weeks and not months. Reporting in the studio, I'm Jeff Deal. Now back to you.